morning, guys. I had Uma Sherrao 6 years back to do transplant. Those days, I would say this patient actually a difficult case because having a very average donor and a diffuse pattern. That was the main concern I had in my mind. I'm very thankful to Uma Sherrao because he did enough research to choose me because it's a surgery basically. You have to go with the best surgeon, not by a lucrative package. See, this is a donor, I am still having it. This is very important to understand. Most of the patients will miss this point. If you don't have a good donor, it is not possible to do second session. Basically, in the lucrative packages surgeries, what they do, they harvest all the area erratically and they try to spoil the donor. Then you don't even get a chance to do a second session. Even this happens with the turkey transplant and any lucrative package transplants in India. So this donor area, we preserved it. Even after 6 years, if you can see, nice donor is available. That is a key role for the future transplantation.
Hello everyone, my name is Uma Maheshwara. For me, six years back, a transplantation happened. So I didn't go for like a lucrative packages and all with other clinics and all. I came for the best clinic for best results. So if you want to choose for a transplantation, go for a best surgeon, then lucrative packages and all.
Planning. My planning starts with every patient because I will directly mark it and see first with the measurements. Next, I will see in the mirror, that is an indirect view. Later, I'll take photos and check it. So there are three levels that I will understand about my marking. If I take 1 centimeter below, would always need more than 400 extra grafts first time and second time. Those grafts rather we can implant in the back. Because every person has a limited donor. That's the point here. So most of the people ask me, doctor, only 1 centimeter, right? Why can't you do? Let me explain. If you do 1 centimeter, this patient has a kind of almost see 17 centimeters length, temple to temple. There are few patients has 27 centimeters. Imagine if you get 1 centimeter down, you're wasting huge number of grafts. All the grafts will go here only. You don't get anything to implant in the back. That is the most of the cases. That is the reason most of the cases go failure. Most of the patients also will not accept to take the higher hairline. Most of the doctors also are not ready to design higher hairline because they are not able to substantiate or explain the consequences of the taking a lower hairline to the patient in the fear of they may lose the patient. Basically, remember, let patient go to next door, no problem. But you need to plan the best way. Otherwise, you end up in a failure transplantation. I have taken here initially, see, I got reasonably good density. Now, I got the opportunity to implant all this area with more density during second session. Now, right now, after the transplantation, is right now with us. So, since morning, almost it took 7 to 7.5 hours to do the procedure. Well, a point to be noted is the same person also had a transplant done with me 6 years back. This bandage will be removed tomorrow. Let me check with him what kind of discomfort he had since morning.
So I'm not feeling any discomfort. Before the surgery, how I was, same. Right now also I'm same feeling.
So during surgery, what point of time you would expect some pain? How much time it will last?
While giving this anesthesia, we'll get little pain. That too for last for 2 minutes. That's it. After that, it will be normal.
Okay. So while doing surgery, were you comfortable throughout the procedure?
Throughout the procedure.
Because we also give you a loo break, lunch break. I don't think it's a big deal. And here is a live example of someone has done a transplant 6 years back, as well as today, right now, 20 minutes back, we have done a surgery. You can see him morning also we had a talk. He was comfortable all these days. But now today, after surgery of 7.5 hours, it's quite normal here. That's the kind of techniques, technology evolved now, and also goes with the surgeon's best surgeon's hand. We planned second session as a part of his procedure, usually after 1 or 2 years, but fortunately it extended to 6 years. Now, yesterday we had a transplant second session. Right now, today it's a first day, post-operative day of the second transplant. I just wanted to know what kind of discomfort he felt even during the first time, all the 6 years, and even second time, even after the second post-operative day.
First time before I came here, I just inquired about the clinic and clearly and the videos and the post-operation suggestions and all. I saw all the videos of Sridhar Reddy sir. These are like very clear-cut information and gives you confidence there itself. Once you reach the clinic and consult the doctor, then you'll get more confident. And the procedure also from first time to this time, everything is same, and the care and the follow-ups and all very good over here, and you will not feel much pain also. And if you want best results, contact the best doctors like Sridhar Reddy sir. And even distance doesn't matter if you get good results. If you don't get good results, back to back, you need to visit the hospitals and all. Right. So if you want better results, contact the better doctors like Sridhar Reddy sir.
And I also am very much happy to share during consultation without seeing you, I don't send you, number one. Number two, during surgery, planning, execution, I'll take enough time. You would have noticed by now, first time also, second time also.
Correct.
That gives me immense pleasure as well as it's privilege to work like that. And that's the idea of looking at you directly, indirectly in the photos, everything to arrive at the best decision for you. That's where we're going to get a good results than only implanting the grafts. Fifth day post-operative feedback. Transplantation done second time with us. Now today is the fifth day post-operative. I just want to ask him, before I want to ask him, I would like to thank him because of coming all the way to give the feedback. Now let me check with him what kind of discomfort he underwent, what kind of support he had got from the clinic, was it worth, or and any suggestions from him. Let's see. Now, number one is discomfort and pain, you will ask. So, Uma Maheshwara, how was the pain and discomfort, swelling in your case? Of course, each patient has a different experience. Swelling also, some guys will get it. Out of 100 patients, 2-3 guys will get swelling. 90-95% will not get swelling. You are fallen into a category that you did not get any swelling. Other than that, was there any discomfort from day 1 to now, 5 days?
I didn't feel any much discomfort. Everything is fine. And the follow-ups from the clinic also very clear. And I followed all of them. So even no swelling also for me. Even the second day also after removing the bandage, everything clear. And for the first 3 days, strip bandage was there. So first 3 days I sprayed that saline water. For spraying saline water and all, I got the all like materials and all like saline water bottle, needle. And
when we are given a saline spray, of course we can simply say you can buy and do it, but all the way I provided a saline bottle, a spray bottle. You don't know which is a sterile one. You don't know. One more needle, that also you don't know why we are given. That needle also sterile, because if I don't give you that, probably you tend to poke with a safety pin or scissors used in the kitchen would lead to kind of a massive infection also. That's the only idea. I have provided a sterile bottle and normal saline, a sterile needle. This is second time we are harvesting the donor from this place, and we have done within safe donor limit. And something we did a balanced donor, same patient view. After 6 months, I would show you. It has to look just as good as before, normal. On this patient view, same view, I show you after 6 months also how we maintained a balanced donor, which is most important. That is really required to go with a expert surgeon. Now implantation, okay, and yeah, this is the area we implanted it. Gently touch it if the hand is clean. This area we implanted small white patches, white dots. These are the fat thing from the grafts, nothing to worry about it. And you need to spray normal saline in this area. Usually no need to spray on the back side. So these are the things. It looks really great, very healthy scalp. He also maintains very well. Now next follow-up is 13th day. If possible, he can come or else he can do his own. So that's what you look at the donor, implanted area, everything is great. I'm very happy to see him here. This is the 13th day post-operative after transplantation. Well, we have done 1 day scalp, 1 day beard. I just wanted to find out a few details from him, Uma Maheshwara Rao. I'm very thankful to him. Number one, pain-wise, how was the pain? Number two, discomfort-wise. Number three, appearance-wise. So these are the three things one should know, because most of the guys want to go to office and they were always skeptical about going to office or not. How does it look like after 13 days? For that reason, I just made this video. You can see in live example 13 days beard as well as scalp we have done. Beard, if you can notice, there is no marks at all. Now, Did you feel any pain all these 13 days?
No, sir. I didn't feel any discomfort.
How is the
pain,
discomfort and
Nothing.
visual, I mean, appearance wise, is it okay?
Yeah, okay, sir.
Okay, and well, today we trimmed your hair also.
Yes.
That with that, no one would know that you have done a transplant.
Yes, sir.
So,
Very natural. Yes.
yeah, is it okay to manage all these 13 days? Now, how do you feel right now?
So here onwards, I think I can go for office also.
Yeah, go to office.
13 days, I did work from home. So tomorrow onwards, I can
You can
go
get
for
back to office
office.
right now. Okay.
Yes.
Do you think anyone can notice now this transplant is
No,
today?
never,
Right now?
never.
Yeah.
They can't.
All these 13 days, well, they can understand that you have done a transplant.
Correct.
After 13 days, I think probably no one. You can
No.
just tell them that I have trimmed my hair. So that's what. You can see the scalp and beard. You can show me the beard also. See, the harvestation done. You don't even understand that what you have done. And even in the scalp also, it's very natural. You can rub and wash it right now. You can also apply some coconut oil. You can also trim it. You can trim it, no problem. So these are the things. Almost it looks like natural after 13 days. One can plan if you have 13 days in your hand. Without any hesitation, you can plan it. Of course, if you're a busy person, maybe 5 days is more than enough. Where you can tie a cloth, scarf, and go to the office. Thank you, Mama Shara.
Thank you, sir.
Thank you so much.